Hey guys, welcome back to my YouTube channel. My name is Onyinyechi with Nurse Human. I'm a family nurse practitioner. Now, before we go ahead and talk about our topic of the day, hypoparathyroidism, make sure that you subscribe to this channel and that you click on that notification button so you're always aware when I release new topics. So let's go ahead and jump into the topic of the day, hypoparathyroidism. Now, the parathyroid gland, they are 4 small glands that release the parathyroid hormone, and they're located behind the thyroid gland in the neck, right? And their main job is to regulate calcium levels in the body. Now, the way they do this is by controlling that calcium absorption. First of all, they can stimulate the intestines to absorb more calcium from the food that we eat. And they can also release some calcium from the bones when it's low in the blood. So they pull some calcium from the bones and say, hey, can we borrow some just for the blood? And depending on how low it is, depends on how much they'll pull. They also regulate phosphate levels by keeping the kidneys from reabsorbing phosphate in the body. I do want to mention here that calcium and phosphate have an inverse relationship in that whenever calcium is high, phosphate is low and vice versa. Now, when hypoparathyroidism happens, we already know that hypo means a low level of something. So hypoparathyroidism means there is a low secretion of the parathyroid hormone in the body. And yes, as you would expect, since the parathyroid hormone helps to regulate calcium levels in the body, when there is a low secretion of the parathyroid hormone, it leads to low levels of calcium in the body. Now, what are the causes of this condition? Some of the causes include a surgical removal of the parathyroid gland tissue in the neck. This may be done during a parathyroidectomy. You know, ectomy means removal. So if a parathyroidectomy procedure was being performed, they could take out some of that parathyroid gland tissue, which could then cause some damage that may cause the hyposecretion of the parathyroid hormone. Another thing is during a thyroidectomy. And we already talked about how the parathyroid glands sit behind the thyroid gland. So pretty much if a thyroidectomy where the thyroid is being taken out was done, there can be damage to the parathyroid gland, or during a neck dissection surgery, because we know that the parathyroid gland and the thyroid glands are located in the neck. So let's go ahead and talk about some of the signs and symptoms that we may see. Remember, I always say match the signs and symptoms to the pathophysiology of what's going on. We already know that there's hyposecretion of the parathyroid gland, which has led to low levels of calcium. So your signs and symptoms you observe in your patients are things that are associated with a low calcium level. Since you already know that calcium is essential for muscle function, for nerve function, as well as even blood clotting, some of the things you might see include muscle cramping, circumoral paresthesia, which means like numbness and tingling of the fingers around the mouth the patient may complain about. Now, if you ever heard of the Chvostek sign, I want you to think cheek. Now, Chvostek sign is something we see in a low calcium level where you tap on the provider taps on the patient's cheeks, and this causes muscle spasms around the mouth, the cheek, and the throat. Another sign that you might hear about is the Trousseau sign. So I want you to think TIE, tie. And this happens when the blood pressure cuff is tied around the arm, and when it's inflated, it causes muscle spasms in the distal extremity. Now, when we have severe tetany, it can cause bronchospasm, laryngeal spasms, dysphagia, and even seizures and dysrhythmias, because we do have muscles in the heart as well. So as the nurse, what is your responsibility? Think about the signs and symptoms we just talked about and assume that if your patient had that, what would you do as the nurse? You know that dysrhythmias can happen because of the muscle spasming, which can also happen in the heart. So you want to monitor the EKG for any possible dysrhythmias, and your job is to notify the physician if you're seeing anything that is disturbing. Assess the patient for signs of neuromuscular irritability. So this is checking on those nerve functions to see if there's any tetany, that might be going on. And then you're going to provide this patient with a high calcium and low phosphorus diet, because we know we already have a low calcium level, so we want to give them foods that are high in calcium. But since calcium and phosphorus have an inverse relationship, where there is low calcium, there is high phosphorus. So we're giving them a high calcium diet, but then we're giving them a low phosphorus diet. You want to also put these patients on seizure precautions, because we talked about how that tetany can also lead to seizures. And lastly, expect to be given medications like calcium gluconate, oral calcium salts, and phosphate binders, and vitamin D, because vitamin D helps to increase the absorption of calcium in the body. And the medications like calcium gluconate and oral calcium salts can help to increase general calcium levels in the body. So I hope this helps you to understand this topic better. Let me know in the comments if you have any questions. Most importantly, make sure that you're subscribed to this YouTube channel. Make sure that you share this with another nursing student who might need it. And just make sure that you like the video if it's something you found helpful, or leave me comments, or leave me encouragement, or honestly leave me some feedback in the comment section if you may. Until next time, I hope to see you back. Thank you for staying till the last slide. Have a wonderful day. Bye-bye.